Derm pathology, autoimmune blistering skin disorders. All right, so this is Pemphigus vulgaris versus Bullous pemphigoid. All right, they're going to try to get you here on differentiating one from another. So I'm going to give you kind of the high yield things you need to know. First off, let's start with Pemphigus vulgaris. Pemphigus vulgaris is potentially fatal. It's much more severe than Bullous pemphigoid. And what they want you to know is the antibodies associated with Pemphigus vulgaris. These are antibodies against desmosomes, okay, in the spinosum, in the stratum spinosum, okay? Very important and high yield. These are IgG antibodies against desmogliin. Okay, it's a component of desmosomes which connect keratinocytes in the stratum spinosum. That is Pemphigus vulgaris. Now, what happens is on gross morphology, you're going to see flaccid bulla. Okay, flaccid is very high yield. Flaccid intraepidural bulla caused by acantholysis, which is separation of the keratinocytes. Okay, and you're going to see that the oral mucosa is usually involved. These are two high-yield things you have to understand. It's flaccid bulla that's caused by acantholysis, and oral mucosa is involved. If you know those, along with the antibodies against the desmosomes in the spinosum, then you've gotten Pemphigus vulgaris down. The last thing you should know is on immunofluorescence, you'll see a reticular pattern around the epidural cells. And you could see they kind of have a really good chart in understanding why that occurs. It's more of a reticular pattern. Okay, and Bullous pemphigoid, it's less severe. These are IgG antibodies against hemidesmosomes. So it's going to be separation, epidural basement membrane separation. So what you're going to see is tense blisters, not flaccid. You're going to see tense blisters containing eosinophils, and the oral mucosa is spared. So you will not have blisters in the mouth. Very high yield to know. Okay, the patient's usually going to be greater than 60 years old, and the mouth is spared. Right? Now, Nikolsky sign is negative here, whereas Nikolsky sign is positive in Pemphigus vulgaris. Lastly, Bullous pemphigoid will present with a linear pattern on immunofluorescence because it is going to be separating the epidural and dermal junction. All right, so the separation from the basement membrane due to the antibodies against the hemidesmosomes gives you that linear pattern on immunofluorescence because it disrupts those hemidesmosomes. All right, so that's the end-all be-all. This is the difference between Pemphigus vulgaris and Bullous pemphigoid. Very straightforward. Remember, flaccid and oral mucosa involved in the Pemphigus vulgaris with desmosomes antibodies, and then Bullous pemphigoid is hemidesmosomes antibodies with tense blisters as well as a mucosa, oral mucosa that's spared.